colic and reflux in infants. That's what we're going to be talking about here. I'm going to give you a wonderful case of reflux and colic in a 6-month-old boy, how we solve that with chiropractic care. More on that in a moment. After we discuss that case, I want to let you know that lots of chiropractors in the United States and around the world work on infants, even checks at the day of birth or shortly thereafter, just checks. We'll talk about that later. So we work on lots of infants, toddlers, young children, adults, elderly. I have many patients in their 90s that come to see me. What I'm getting at is anywhere from 1 day old to 100+ years old. If you have a spine and we're breathing, you can be checked by a chiropractor. What we do for an infant is different than what we do for an adult, as you can imagine, right? We tailor our adjustments and treatments in the chiropractic office so it's appropriate for a 3-week-old, a 6-month-old, a 20-year-old, and so forth. So keep that in mind. Then I'm going to touch on other reasons that people bring in their infants and children to the chiropractor: ear infections, allergies, asthma, ADD and ADHD, headaches. We'll get into these types of cases moving forward. So stay tuned for those. Let's go first with this case here, talking about a 6-month-old boy that was brought to me last year in 2016. Let me give you a little background. Mom's first child, and the 6-month-old was having terrible colic, terrible reflux. I called it explosive reflux, okay? Would eat a meal and out it would come. Eat another meal, out it would come, right? Mom is going crazy. She doesn't know what to do. She starts at the pediatrician's office. They didn't know what to do. They gave her some suggestions, didn't work. She goes to a pediatric gastroenterologist. They start doing some tests, couldn't find anything. They took the baby off of the breast milk and put on formula, thinking that maybe there was a sensitivity or allergy to the breast milk. No result. And then the 6-month-old was put on medication. Actually, it's 5.5-month-old at the time. 5.5-month-old put on medication, and it didn't work. So now she's really losing it, right? So luckily, she was going to a chiropractor, not me, but was going to a chiropractor that knew me. She asked, in desperation, "Can chiropractic help my son?" And he said, "Probably. But I don't do kids," said the chiropractor. "I know Fuller does, me," right? So she immediately brought him in to see me, and good things started happening. So this is what she wrote about her son. I would like to thank Dr. Scott Fuller and his wonderful front desk staff. Thank you, front desk staff, for being wonderful. I very much appreciate that. Thank you for their help. Dr. Fuller was a miracle worker on my infant son. I was at my wit's end, sleep deprived, as my son had a dairy allergy and also colic, as we talked about, this explosive reflux. We were referred by another chiropractor to see Dr. Fuller. He was 5.5 months old, and after 6 appointments with me, 6 chiropractic adjustments, he was like a new baby. The gut-wrenching screams and spit up that was happening regularly decreased and then stopped. How wonderful is that? 6 visits to see me. That's awesome. It was a miracle, she is saying. Dr. Fuller was so gentle with my son, and my son would just smile and gaze while I was getting adjusted. A little bit on that. I have a specialty chiropractic instrument. If you've been to a chiropractor, you know what I'm talking about. So it's a light force instrument that goes up and down the spine. It's very light tap. Okay? I have one that's powered, and it gives multiple taps along the spine. We're going to talk about how that works in a couple of minutes. So that's all I did. I didn't do any manual adjusting at all. Just the instrument, nothing else. And it worked like a champ. He was off his medication, reflux gone, colic gone. Happy baby, happy parents, right? I wish I knew sooner how helpful chiropractic care was going to be for my child. It completely makes sense neurologically. I just never thought of it that way. I'm forever grateful for Dr. Fuller's time and attention to my little guy. I also constantly refer, now pay attention to this, I also constantly refer Dr. Fuller to my mom friends that are suffering from sleep deprivation and, in quotes, tough babies. Thank you, she said. So that was just such a wonderful, easy, quick, inexpensive solution. No medications needed, very simple stuff. Neurologically, structurally, glandularly, endocrine system wise. We're going to talk about how that worked. Now, let me give you a couple of other examples before I get into the anatomy of what occurred, okay? Ear infections, I've talked about these on prior shows as well. Using the case of Darlene, she was 1 year old when her parents brought her in after being referred by her pediatrician. So this child's pediatrician referred that child, Darlene, directly to me because she had already had 20 ear infections in 10 months and was sick continuously for 2 to 3 months. Basically, this child was sick their entire lives with rounds and rounds of antibiotics, not getting better. And I remember the pediatrician said, your child's heading for tubes, but I don't like to do tube surgeries, and I don't know what else to do, but I know this weirdo chiropractor in Woburn that seems to be having some success with infants and ear infections. And they said, okay, we'll try that, right? So in they brought in Darlene. Darlene's parents noticed improvements after 2 chiropractic adjustments. She was eating more, not as upset, happier and smiling, and walking a lot more. After 5 treatments, her mom noticed Darlene was more responsive, alive, bright, awake, and communicating more. After 6 treatments, the pediatrician now observed a significant reduction in the fluid in her ears. So of course, pediatricians are monitoring fluid, not only looking for active infections, but just looking to see if the fluid is in there, right? So the pediatrician could see, wow, that fluid's really coming down. And she was a totally different child, said the pediatrician. 6 months later, her ears and sinuses were totally clear. Great stuff. And that was 20 years ago. The other case I've mentioned on the show before and on my videos was Haley. A 1.5-year-old Haley had 15 ear infections in 12 months. Tubes were recommended, but parents decided to try chiropractic instead. And she also noticed measurable, significant changes after 2 chiropractic adjustments. She was free of ear infections for 4 years, had 1 more, and then none ever since. And again, that was about 20 years ago. Her parents also noted Haley was talking more, sleeping better, and eating better once she was under chiropractic care. Their second child began care at my office at 3 weeks old. So they decided, wow, you know, we waited for a 1.5 years into this child's life to bring into the chiropractor. With our second child, and now since then their third child, they didn't wait. We were doing wellness checks early on, and that's a wonderful thing to do, to try to prevent illness before it began. It is amazing to me, says Mom, that I could have had Haley put under anesthesia and operated on at the young age of 1.5, and she would still have problems. So that's a little bit about ear infections. Now I'm going to talk about some other cases of asthma and allergies and some simple, inexpensive, fast cures there as well. But let me talk about the neurology first. So this is my favorite chart that I like to use to explain to you of what's occurring with the chiropractic care. When we're born, our brain hasn't developed fully. All the brain cells are there, but they haven't developed fully. The part of the nervous system that runs things automatically. So right now, your viscera are working, your liver's working, you're digesting food, you're eliminating waste, your immune system is working. All these things are happening automatically without conscious thought. And that's called your autonomic nervous system, or if you will, your automatic nervous system. And there's 2 main divisions. There are 3, but let's just say 2 main divisions: sympathetic and parasympathetic. Sympathetic are the ones that turn things on and up. Parasympathetics turn things down. For the most part, those are the basics. It's a little more complicated than that, but let's just say on, off. If you have to run down the street, you crank up your sympathetics. If you need to go to bed at night, you crank up your parasympathetics. Well, when we're born, again, the brain hasn't developed fully. So the sympathetic chain, these groups of nerves alongside the spine here, are working a little bit harder. They're a little out of control. That's why our respiration is up, our heartbeat is up. Our gastrointestinal system is working a little bit quicker as an infant, right, than it is as an adult. So one of the things that has not happened yet is this sympathetic chain has not been dampened or appropriately quieted down by the brain. All right? So if these are cranked up, and let's say neurologically, whether it be segments of the spine that are not functioning well, okay, we're not getting the dampening effect that's going to quiet down the activity in the organs. So let's say that we have a digestive system, a stomach, that's not functioning properly because it's just kind of going crazy, if you will, because the sympathetics are not being checked. There's the reflux, there's the colic, there's the digestive system complaints because they're not getting enough blood flow. They're not getting enough of their neurological input. Now, the digestive system is more of a parasympathetic function, okay? That's why you can run around with your sympathetics, sit down, have a big Thanksgiving meal. Now all the blood flow and attention goes to the gut and you want to sleep. You don't want to run around after the Thanksgiving meal. So we're always in that balance, sympathetic, parasympathetic. They're always in a balance. And when you go to bed at night, you don't want to do 100 wind sprints and then try to go to sleep, okay? Because you've just cranked up your sympathetics with those chemicals. Okay. What chiropractic does is very simple. What we do is we analyze the spine. We analyze the spine for any misalignments, fixations, misalignments called subluxations, any of these problems in the spine that can occur at birth, right after birth, and even these misalignments can happen with the way that we were lying in the uterus during development, you see? So we think about it, why does an infant need to be checked? Because if we had intrauterine lies that messed us up, that's misalignment number one. And then during the childbirth process, whether it be a natural birth or a C-section, whatever, that can further cause instant misalignments right then and there. When do you want to check that? You want to check that right now. It's easy to fix, easy to take care of. That's why these cases that I was just talking about were so responded so quickly, because the misalignments have only been there for days or weeks or months, right? Easy to take care of, okay? So when these spinal bones are locked, stuck, glued, misaligned, subluxated, whatever they are, that is taking away neurological information locally at the cord level and also away from the brain. The number one input to the brain are all those special nerve endings in and around the spine. Spine's not working right, brain's not working right. Brain doesn't work right, you don't get the appropriate neurological and blood flow activity to all your organs. Follow? Again, spine not working, brain's not working to capacity, organs become dysfunctional. Simple. Chiropractor comes in, come in, I tap on and I stimulate these special nerve endings in here, which fire the brain. That's it. That's the only piece of the chiropractic, whether it's a 1-day-old, somebody who's 30 years old, or somebody who's 95. Doesn't matter. We stimulate and harness these nerve pools here, which fire the brain, and I step away. Then the magic happens. Then nature, then your body's ability to heal. Then the automatic processes work better. I didn't heal these children. All I did was increase the nerve stimulation from those special nerve endings buried in the tissues around the spine. That's all I did. I activated this and stepped back and said, what's going to happen? I don't know. Hopefully something good, right? And luckily in all of these cases, great things happened. Chiropractor stimulates those special nerve endings, fires the brain. Brain says, thank you. That's the power that I needed to work better. And you get rewarded by dampening the sympathetic chain a little bit, as I talked about earlier. These quiet down, gut activity comes up a little bit, reflux goes away, colic gets better. In the case of the ears, a couple of things happen. Immune system works better, number one, and number two, there's a tiny muscle in the eustachian tube. And the eustachian tube's tiny muscle, the tensor veli palatini, that will be on your quiz. That muscle is controlled by nerve endings in the upper neck, influenced by nerve endings in the upper neck. So if these aren't working, that muscle holds the eustachian tube closed. The ear can't drain into the throat. The ear can't drain. The fluid backs up. Pediatrician sees the fluid, might say yes ear infection or no ear infection, but there's still fluid in there. Chiropractor comes in, stimulates nerve endings, removes the misalignments and subluxations in here, improving nerve activity to the cranial nerve that controls that little muscle. Muscle relaxes, tube opens up, fluid drains, cool system. Okay, got that? As a review, what we need is better functioning organs in all of these situations here and a better functioning immune system. Chiropractor doesn't heal, but chiropractor stimulates those positive special nerve endings in there, firing the brain, plus some local cord reflexes, too much for this class, but fires the brain, and then the magic happens, body heals itself, it has an opportunity to heal. Then you see these parents noticing that their kids are doing better with colic going away, with reflux going away, with ear infections getting better, and some other things here that we're going to talk about right now. Okay, follow? That's how it works. This is your amazing body. This is your priceless machine that you possess. And it's so important to get these kids checked because it's so easy to correct them. As you can see, it doesn't take 3 times a week for 6 months like it does with adults. This is what's going on in here. Do you follow? Okay, so that's how the chiropractic works. Well, let's take a couple of minutes and go through some other cases that I wanted to show you. So here's the ear infection cases, and I want to talk about some allergies. Now, in some cases, the solution is not chiropractic. And by the way, of course, as I'm talking about these kids with colic, with reflux, with ear infections and so forth, are they going to get better, all of them going to get better with chiropractic care? Absolutely not. We never promise results. But a lot of them do get better. They get better when people try it out and other things are not happening, like time, like medication. Okay? In the case of Abigail, this is an interesting one here. She has allergies. I'd like to take a moment to thank you for your advice and the information you sent on milk allergies in children, said Abigail's mom, Jen. Since Abigail was 9 months old, coincidentally the time I quit breastfeeding, right after breastfeeding stopped, problems started, I've been struggling with repetitive ear infections, colds, allergy problems, constant runny nose, waking up coughing, and various other ailments. Follow? She just turned 2, and it's been a long year. We have talked numerous times with a pediatrician and an allergist concerning all of these symptoms that she has, okay? I knew there were allergies, as I suffered allergies bad enough as a child to require shots, says mom, okay? We switched her to organic soy milk at the age of 12 months, although I still use regular cow's milk in cooking. This is before my recommendation, right? I bought HEPA air filters for a room, bought a new vacuum with a HEPA air filter and so forth, right? Put cheesecloth over the vents in her room, bought a, removed the stuffed animals, changed her sheets every 2 to 3 days. If you have a child with allergies, you know exactly what I'm talking about. You're trying to clean up the environment as best you can, but you probably have found oftentimes the problems don't go away. Her symptoms improved marginally, but not enough to satisfy me. We tried to vary amounts of daily medications per her allergist recommendations, Zyrtec, Flonase, Nasonex, and so forth. Some helped for a short time, but it was difficult to give an infant or a toddler medications on a regular basis, and mom wasn't really happy with that. After consultation with me, and she was many states away, this was a friend of a friend, so I was just giving her some advice through phone calls and emails. I decided to take her off all milk products, dairy products per my advice. There were results within days. Within 3 days, her runny nose eased up to almost half of what it was been. Within 5 to 7 days, her waking up in the middle of the night coughing completely ceased. Within 10 days, her runny nose disappeared. Also by that time, the dark circles under her eyes lessened considerably. Another sign of a food sensitivity, those dark circles. It's now been over 1 month and I will not go back to having milk in our diets. She has never had behavior problems before, other than that what I might consider normal kid stuff, said mom, but it's amazingly less now. She also sleeps more soundly. All of these symptoms peeled away by just removing cow's products. Milk, cheese, cottage cheese, yogurt, ice cream, cream, butter. We took that out of her nutrition. You're going to see that as a recurring theme here as well. And by the way, the other children coming in when they have the ear infections, I say, no dairy products. Great idea, get off of that. And for some children, they just eliminate that and their ear infections go away. This is an important point now, both her pediatrician and her allergist believe that I am overreacting, as her tests showed no sign of being allergic to milk. I argued that the results speak for themselves, said mom, right? Again, I'd like to thank you for opening our eyes to this common problem in our society with people having a sensitivity to dairy products. So once again, here's another simple solution that was easy, cost nothing, and had just wonderful results in all of those symptoms: colds, allergies, ear infections, and so forth. Okay? Asthma and eczema. I want to talk about this case here. This is Caitlin. The parents brought 10-year-old Caitlin to my office after being referred in by another chiropractor. She had severe asthma since age 2.5 with multiple allergies and eczema. Now I've done a show here on allergies, asthma, and eczema, and I talk about the two things that I recommend before we have to dig a little bit further. And it's usually pretty easy: chiropractic care and elimination of dairy products. And many of those kids, not all, but many of those kids at least get better. She had seen multiple doctors and had taken many different medications as a 10-year-old. After 2 chiropractic treatments, her lung capacity increased from 220 to 280 milliliters, something that you can actually measure. The volume of her lungs were already expanding and going up after 2 visits. And in 1 month, it increased to 325 milliliters. Her skin improved after significantly reducing her dairy intake, and after 5 months of care, her updated pulmonary tests were better than ever. 8 months of care, she was able to eliminate the 16 pills a day that she was taking. 16 pills a day for a 10-year-old, and they really were just keeping her symptoms down a little bit. She did have periods of difficulty, but overall her condition improved greatly. What has happened to Katie's asthma is nothing short of a miracle. We did it with some chiropractic care and elimination of dairy products, and that took care of the asthma and eczema. Just a fantastic case, and we had such a good time seeing that improve over time. So now we have a list of things. We've talked about the reflux and the colic, the ear infections, the allergies, the asthma, and the eczema. That's quite a list that we're building here. Now we move into ADD and ADHD. Thinking back to my chart of the neurological stimulation from the chiropractic care, all we're doing is we're stimulating those very special, very powerful, highly concentrated nerve endings in the spinal tissues, which help activate brain circuits, so the brain circuits get stronger. Think of what we're doing is we're making the brain lift weights. And if the brain gets stronger, all systems have a potential of working better. That's what happens here with ADD and ADHD. So in Michael's case, he was age 7, diagnosed with ADHD, pediatrician recommended medication, parents didn't want to do medication, they were being pressured by school system and so forth to put him on medication. They decided to bring him in, and this was now 14 years ago. I recommended nutrition changes, no dairy products, omega-3 fish oil, coordination-based exercises, and of course chiropractic care. Within 2 months, symptoms improved dramatically. He was able to sit in school and be focused. The results were so dramatic, people that knew the family and knew Michael thought that he was being medicated now for his ADHD. That's how impressive his changes were. And no, he wasn't being medicated. He just did the nutrition thing, the appropriate brain supplement thing, the coordination-based exercises, and the chiropractic care, which just made the brain circuits work better, so he was able to focus and concentrate. Nailed that case. And then there was Evan. Evan had a plethora of symptoms. Thank you, Dr. Fuller, for helping Evan become a normal, healthy 11-year-old. Prior to seeing you, he was weak, chronically sick, and suffered from emotional problems and learning disabilities. His pediatricians were unable to figure out why his immune system was not functioning properly and kept prescribing more and more antibiotics until he wound up in the hospital with serious stomach disease. Okay? So we've got a really sick child here. He also suffered from daily debilitating headaches, another case of headaches, and his legs were so weak he could barely run. Here he is, 10 years old when he was brought to me. He couldn't run. He didn't have the coordination ability in the brain to make that running motion occur. We were desperate for answers, and they came here. The regular adjustments and prescribed exercise, coordination-based exercise, more on one side than the other. I've covered that in other shows. Along with a change in diet and nutritional supplementation you recommended has changed his life. He is now happy, confident, and well. The balance and coordination exercises have been so successful now, he can now juggle. Okay, so his coordination-based systems, his cerebellum, his frontal lobe, all this is working a lot better. The supplements to keep his immune system strong, the adjustments have cured everything from swimmer's ears to daily headaches. That's just awesome. His academic performance has improved and his learning disabilities are much less pronounced. I mean, that's just an awesome case of, again, coming in with a multi-pronged approach, naturally, doing the best we can to get the best result, helping these kids be the best version of themselves by just doing healthy, reasonable, natural things. nutritional changes, maybe elimination of dairy products, a few supplements because most of us are deficient in certain things such as omega-3 fats, B vitamins, probiotics, and so forth. And then we'll give them coordination-based exercises if needed. We do the chiropractic thing, and wonderful things begin to happen. We also mentioned headaches with Evan's case, and then we have this case of migraine headaches in a 9-year-old, Brian. 9 years old, starting to have frequent migraine headaches. Some headaches lasted up to a week. His headaches were so frequent, he missed 23 days of school in the 5th grade. This is before he saw me. 23 days of missed school. That's a lot. He had a CT scan. Now, of course, it's not normal for an 8-year-old prior to seeing me to have headaches. So you want to make sure that there's no big bad boo-boo in the brain. Have the scan if necessary. And the neurology workups didn't reveal anything. He was put on migraine medication, but the headaches still came through frequently, even on the migraine headaches. Medically, they didn't know what to do, so it was affecting everything from his sports to his schoolwork. Luckily, a friend of the family knew me. They suggested, hey, try Fuller. They're like, okay, we'll give it a shot. Nothing else is working. I remember his case clear as day. So I'm doing his exam, and the interesting thing about Brian's case is he had no neck pain. He just had headaches. So I focused my concentration on the neck, knowing that neurological connection that I explained earlier. As soon as I stuck my thumb and fingers in the back of his head, right at the base of the skull here, he said, ow, I could feel a big knot back here. He said, that hurts, and that makes my headache worse. So I wanted to establish the connection between what's going on in the upper neck and the headache for myself, and then of course for him and his parents, okay? So I did neck adjustments. I did neck treatments at the chiropractic office. His evaluation revealed misalignments in his neck. He had a big muscle knot at the top of the neck near his skull. After several weeks of chiropractic adjustments, his migraines were now gone. He does not need the medications anymore, and he does not miss school any longer for headaches. He's been headache-free for 2 years now. Actually, it's more like 8 years since he's been coming to see me. So that is, again, a quick, easy, incredibly inexpensive solution compared to if you add up the scans and the neurological tests and the medications and then miss school and all the other doctor's visits and so forth. And he saw me for a couple of months and we knocked those headaches out. I mean, very inexpensive. One of the things that we recommend is, okay, so we have all these kids that have these problems. Well, what about some prevention here? And I think that that's what true healthcare is get somebody into the best version of themselves, ideal health, and then hold you there, hold us there, hold me there for as long as we can throughout our life. That is what I call healthcare. And what I recommend is have infant wellness checks by the chiropractor. Just checks. Maybe they need an adjustment, maybe not. In most of the cases, babies don't even know we're doing it because it's so light force. True healthcare is the prevention. Here's a couple of websites if you want more information about infant and children analysis and chiropractic care and other things. ICPA4kids.org, great website. And another website is new to me, massbirth.com. There's lots of information on lactation assistance, doulas, chiropractic care, midwifery, a lot of activities on that website that will help you a lot. So that website is very helpful. On a prior show, I talked about brain function. I just want to put this in here because we're talking about the brain being the crux of everything, which it is. And just keep in mind, as your child is developing, as your children are developing, reducing poisons, as we've talked about, is reducing electronics and reducing when electronics are introduced to infants. Try to let that time lag be as long as possible. Don't give it to infants right away. Better nutrition, making sure we're getting enough water, a lot of movement, a lot of crawling when they're younger, chiropractic checks, appropriate rest. Massage, acupuncture, and meditation later on would be when children become a little bit older, when it is appropriate. So remember, lots of children, lots of infants have seen wonderful improvements with chiropractic care, so consider getting your children checked. I'm Dr. Scott Fuller. Join me again.
you.